Usmle Step 3 flashcards. Complications of rubella. Complications of rubella are arthritis, thrombocytopenia, encephalitis. In primary hyperparathyroidism, what is the urine calcium level? In primary hyperparathyroidism, urine calcium is more than 200 milligram per deciliter. If the urine calcium is less than 100 milligram per deciliter and serum calcium is high as well as the parathyroid hormone is normal to high, then this is familial hypocalciuric hypercalcemia. In Men's syndrome, where is the mutation present? In Men's syndrome, mutation is present in RET gene. What are the contraindications to colchicine? The contraindications to colchicine are severe liver disease, renal disease combined with another drug inhibiting cytochrome P450 system. So colchicine should not be combined with other drug which inhibits cytochrome P450 system. Whipple's triad. So what is Whipple's triad? Whipple's triad are the patients presenting with the symptoms of hypoglycemia, have a patient having low blood sugar, as well as the patient recovered after glucose administration. If the patient has this Whipple triad, what do you do? If the patient has this Whipple triad, you should evaluate the patient for hypoglycemic disorders, such as you should check serum insulin, C-peptide levels, pro-insulin, and serum assay of hypoglycemic agents. TSS occur due to exotoxin produced by Staphylococcus aureus. Exotoxin TSS toxin 1 acts as super antigen. It activates T cells, and that causes massive cytokine production. What are the contraindications to NSAIDs? Contraindication to NSAIDs are acute or chronic renal disease, congestive heart failure, peptic ulcer disease, NSAID sensitivity, and currently on anticoagulation. What is the treatment of mixed cryoglobulinemia with hepatitis C? The treatment of mixed cryoglobulinemia with hepatitis C are the antiviral therapy, that is alpha interferon plus ribavirin. In multiple myeloma, what are the levels of parathyroid hormone related peptide, parathyroid hormone, and vitamin D? In multiple myeloma, the parathyroid hormone related peptide is not present, parathyroid hormone is low, and vitamin D is also low. What is the cervical cancer screening in SLE patients or organ transplant patients or immunocompromised patients? The cervical cancer screening in these patients are PEP test at the onset of sexual activity, as well as you should do a PEP test and HPV co-testing annually for these patients. Thank you.